Hi there. Welcome to the November Allume All Hands webinar. I appreciate that you taking the time to check in and hear about how we're doing as a company. So every month I like to give a little bit of a update, let you know where we're headed, how we're doing, and receive some announcements about some cool stuff that we're doing to grow. So here's where we are, company milestones. I've shown this to you before, and it tracks what our big milestones are, shows you that we launched our continuous care and full suite of services in the early part of 2018, in February actually 2018, and here we are in October 2018, where we're doing about 4,700 hours a month. Our goal is to get to 13,000 hours a month. So something you should know is that you're out there, especially you in the field, you beloved souls that we so appreciate. So we track heavily the number of hours that are being provided, and we look at all sorts of data about the hours. We want to know, we want to look at each patient and see how many hours are being filled for each patient, what's the percentage of those hours that are the total capacity that could be served, and of course we want the highest possible percentage to be provided because it's the best thing for the patient and for the family. We also look at hours because hours for us helps us see when and where we are at a point of financial break even. So as you probably know, our company started about 2.5 years ago, and my very wonderful husband Frank and I have been honored to invest in and to build this extraordinary idea around remarkable care and providing great care to families, especially those with medically fragile loved ones. And so we have put a lot of our personal savings into this company. And so 13,000 hours is an important moment for us because it represents the point in time when the business is operating at a level where we break even, meaning that our costs are covered by the services we fill. And so that is a moment where Frank and I start to have less of a need to put financials in. At this point, of course, we're still investing heavily in the company, and there is no financial compensation for us, and that's totally fine because that's part of what we're investing in a concept and an idea to grow. But I want you to know where we are and the importance of hitting these 13,000 hours and 25,000 hours, because 13,000 hours helps us cover our basic costs, but it doesn't help us to grow, and it doesn't help us to invest in the future for bigger things that the company might need, that your patients might need. At 25,000 hours, that's when we really are what I would call self-sustaining. So we have a goal as a company to get there, and we want to do that more or less over the next, by early 2020s, we want to get to 25,000 hours. That's our goal. In the meantime, Frank and I are blessed to have the opportunity to support this amazing adventure, and we will continue to do so quite happily. But it's good for you to know where and how all of what we're doing is being funded. So we want to get across that finish line, and any help that you can do to help us along with that will certainly be appreciated. So here's some more objectives that you can look at, and these are all aligned with our goals for both remarkable care and our goals to surround families with a full schedule with great nurses and care providers. It's also part of it helps us with our areas of sustainability and financial solvency. So all of this together helps us move together in one direction and be aligned. So we want to grow our continuous care practice by 1,000 hours per month. That's a goal we have. It's not something we're trying to do right now, but we're trying to grow our ability to recruit and retain wonderful talent at that level. So this is a really important focus for us, and to meet this goal, we really need your help. And one of the things that we are running this month, and there's a separate video specifically on this, is we're running between now and the end of December, a really, what I hope you will find to be provocative and exciting opportunity to participate and share in our growth, to be able to have a win-win where you can receive some extra dollars, especially right before the holidays, and we can at the same time bring in some more really great people. So we're offering $1,000 employee referral bonus plan right now between now and the end of December. We are also asking you in a very simple way to help us grow and get our name out and become receive more traffic to our social media pages by asking you to make comments, thumbs up, and make comments in any way you can on Facebook, our Allume Facebook page, along with our CT Nurse Network page. You can't believe how much this helps us. It really helps us increase our likability factor on Facebook, and then it shows more of what we're doing to more people and more of our audience, and it helps us to get the name out and the word out about our company. So if you would please do that, and there's more information coming on that as well, we would greatly appreciate it, and it would help us tremendously with many of our objectives. So the objective number 2 here you'll see is grow skilled medical to 150 visits per month by December 2019. With half being Medicare. So we are hitting these goals of getting those visits, but we are not with the right Medicare mix. This is just something for you to know about. Medicare mix, Medicare pays a little more. The more we have a little bit of this offset of Medicare patients, it helps us to just stabilize and diversify our risk in operating in a busy and often turbulent environment of healthcare, right, where things change, rules change. So it's something that we're working on. The third thing is that we want to hire, onboard, and train 10 to 15 nurses per month. And really, we're trying to get to grow to do 20 nurses a month. So again, that employee referral program would help us with that. We are adding every month, and we're bringing in lots of people. Unfortunately, we're not quite to that 1,000 hours a month adding every month, and largely it's because of changes that happen in the existing schedule that cause us to have a leaky bucket. So when people call out or people have unexpected things go on where the schedule changes, then we experience some challenge there. Next thing is we would like very much, for all kinds of good reasons, we would like to have our average hours per employee go up. So for our direct care workers, we started measuring this in July, and at that time it was 9 hours per employee per month, and now it's grown all the way up to 22 hours per week per employee. And this is really great, and we hope to see this continue to increase. We find that when we have team members who are working with us more consistently, we're better able to reach out to families because there's a smaller team. So what we're asking you is, if you are someone who's working less than 30 hours a week, we would really love to know, what would it take to convince you to take more hours on? What would make that deal work for you? If you would please reach out to us, talk to your case managers, talk to me, send me an email and say, I want to talk about this. I'd love to work more hours with Allume, and I have a couple of questions, or I have a couple of needs. Please engage in a conversation with us about that. It also, we're going to be rolling out a sort of a incentive compensation structure over the next couple of months. And when we do, you'll find that there's a lot more of incentives for people who work 20 or 30 or even 40 hours a week. And we want to make that really super exciting for anybody who is able to work more hours. All right, so the next one we have is 95% of our visit notes completed on the same day as the service is rendered. So this is one of our policies, as you probably recall from orientation and from past months training. We have seen improvement in this, and we are very grateful. But in the last couple of weeks of October, we've seen a little bit of a decline. People have kind of gotten a little bit slack on this. We would ask you to please remember that the 24-hour note rule is super important for clinical quality. It also allows for us to process everything as quickly as we need to in terms of payroll and billing. So please, please, please be sure to get your notes in on time. The next one, number 5, is 95% of continuous care. I just said that one. Is the continued care notes received into the office. So again, that is another one that we've had a little bit of a hiccup. It's just been not everybody is getting their notes in on time. We ask you to please get your written notes in to us by Monday at noon and no later. A lot of things happen in the office here at 12:01 on Monday, and if your notes aren't in, it really, really does cause us to have to spend extra time and dollars to go and collect it. So please, please, please get your notes on time. Next, no more than one call out per employee per quarter. Again, this helps with our patients, making sure that they are receiving the highest quality care, they're not being surprised, and that we're committing to and fulfilling on our biggest promise, which is to show up and be there. And hopefully to provide remarkable care while we're there. So please, please continue to have such excellent refrain from call-outs. We know that they happen sometimes, and we understand that. But thank you for all of you for always showing up. The next is to have 80% fully scheduled for new continuous care patients. So this is a goal that we really try to hit when we start with a family. We tell them that we like to try to have a 70% full schedule. We know that over time, over the first 3 to 6 months, it takes time to stabilize. And then hopefully after about 6 months, we hopefully can get the schedule to about 90% or more. So any help you can do, and so many of you are. So when you watch the Remarkable Care Awards, you'll see all the people who are not calling out and all the people who are filling in. I can't remember the number off the top of my head, but I want to say it's like 70 shifts this month were filled by people willing to fill in. And this really helps us to provide the kind of care and consistency that we like to our families. So thank you very much for listening to this month's all hands webinar. If you have any questions, feel free to reach out to me. You can always connect with me at coco@allumecares.com, coco@allumecares.com. I hope you're having a great day. And if I don't get to see you or talk to you, have a happy Thanksgiving. At this time of year, I'm always so blessed to think of all the things in my life. And right now, you and this team are at the very top of my list. So, all right. Thanks, guys. Go make the world a better place.